In Somalia, the fight against COVID-19 took a dramatic turn when the World Health Organization stepped in to help with a record-breaking vaccine rollout. But what happened next was truly shocking. Imagine a country where hospitals were overwhelmed and people were grappling with breathlessness and short of oxygen to breathe. This was the reality in Somalia not so far in the past. But then, on the 15th of March 2021, 300,000 doses of COVID-19 vaccines arrived in the country, donated by the COVAX facility. This was a ray of hope in the dark days of the pandemic. The WHO and UNICEF worked tirelessly to support Somalia in preparing a national vaccine deployment plan. An extensive micro-planning and readiness exercise was conducted nationwide before the arrival of the vaccine. And within just one day of the arrival of these vaccines, the nationwide COVID-19 vaccination campaign began in Mogadishu, the capital city of Somalia. The country targeted healthcare workers, elderly people, and those with chronic medical conditions for vaccination during the first phase of the campaign.
That you are helping prevent circulation and spread of all the variants which are spreading so fast. Getting vaccines also means that you are helping to prevent emergence of any other new variant which can spread faster and be more transmissible. Take vaccine, protect yourself and protect those around you. Let us end this pandemic by being vaccinated and by following all public health measures together.
By December 2021, in less than a year, 5% of the eligible adult population had received their complete primary series of COVID-19 vaccines, with 7% partially vaccinated. But the country continued to grapple with vaccine inequity. About 1.5 times more males were vaccinated than females in all age groups in 2021. The COVID-19 vaccination campaign gradually gained speed and momentum in 2022 as the accelerated campaign for COVID-19 vaccines was integrated with routine immunization in marginalized population settings, which were not accessible before owing to security concerns. By the end of March 2022, the country had administered over 95% of all the COVID-19 vaccines received. The story continued, and towards the end of 2022, an accelerated campaign was launched throughout the country with routine immunization to address the gender gap, as well as other vaccine inequities. Over 37,000 surge health workforce, which includes vaccinators, data collectors, and social mobilizers in over 5,000 teams, were deployed for this accelerated campaign. With interventions at all levels, the vaccine inequity and gender gap was closing. By the end of 31st December 2022, the country was able to administer 8,726,329 doses of the COVID-19 vaccines, resulting in 41.7% of its people fully vaccinated against the primary series COVID-19 vaccines, with 7% of its people partially vaccinated. This was a giant leap from December 2021, when the country was able to administer only 1,605,072 doses of the COVID-19 vaccine and vaccinate fully only 5% of its population. In addition, this accelerated campaign resulted in identifying and vaccinating 84,600 zero-dose children, 113,000 children receiving measles vaccine who have missed out on their vaccines, and more than 25,000 women received tetanus toxoid vaccine. After this campaign, the country witnessed that 48% of the women in the population eligible to receive COVID-19 vaccine were fully vaccinated, against 52% of men receiving the full primary series COVID-19 vaccines. The story of Somalia's vaccine rollout is one of hope, courage, and the power of coming together in a time of crisis. This is the result of the right strategy, the right plan, and the implementation of the plan in a timely manner. Using a combination of fixed and community outreach vaccination sites, integrating COVID-19 vaccination with routine immunization, using additional vaccinators, predominantly who are females, and delivering integrated immunization services close to marginalized populations have resulted in this success. It's a reminder that even in the face of great adversity, humanity can achieve incredible things when we work together. This is a truly inspiring story, showing us the impact that a united effort can have on the world.